the thinking about the trajectory and the things that have changed from papers being submitted by mail, or revisions and reviews by faxes and all of the rest, and to now where there's no hard copy of the journal at all is published. I hope most of it is for the better. I would say, George, one of your when you were leading the journal, one of the big advances was trying to get the printed copies out around the world and to try to really get broad distribution of the journal. And now that's become, actually, just automatic because of the ability to open access, publish it, and have it available on everybody's computer via the internet. So, but thinking about how the journal has changed over the years in terms of its focus and energy.
I didn't leave the journal with any feelings that, gee, there was something that I should have done with it. It certainly helped working with Gary, and it helped having a co-editor who'd sit down that you were good friends with, and again worked with goodwill to think about things that Gary might think about things I didn't, or vice versa. I think that helped a lot. But yeah, the science selection, I think, is excellent. So I certainly encourage those to continue. I think that they help a lot in promoting the journal in a very positive way.
One thing I really thought was a big contributor to for EHP growth was the increased publication of quality review articles. See, in my opinion, environmental health is such a broad thing that it's really, how do you reach across disciplines? And you do that by a journal publishing review articles that are understandable by a broader group of people who can take nuggets of truth from those review articles and apply it to their own research.
Thinking forward, are there topics or challenges that you see for a journal like EHP in the future?
Well, in this polarized world, and it certainly seems to be becoming more and more polarized, I think the journal has established its credentials. It's a well-respected journal, and the way it stays well-respected is to make sure that it's moderate views in terms of and not, I think Ken mentioned this earlier, not drifting one way or another towards different poles of arguments that inevitably will arise in the scientific regarding scientific findings, what they mean for health, how they should be what scientific information should be used in public health policy, how it should be used, and those things aren't going to go away. Those issues are not going to go away. They're just going to continue to surprise us, no matter what they are. And it's important that EHP maintain that sort of honest, clear thinking communicator of what the science really means.
I agree with George, and that's when I took over. That's one of the goals, was to have an objective view of the research that was being published in the journal, and trying not to give both sides when there were differences.
So environmental health sciences certainly lives in a scientific space that is, which has lots of political interests involved in it. So we have to be aware of that all the time at the journal. The other thing that's changed, of course, is that, since, EHP has been around, there are now other journals that also sort of occupy this space, maybe more now than there have been in the past. So I think, EHP is, a special journal because of its relationship with NIEHS and its sponsorship by NIEHS. So I think one of the things going forward is, how does this journal stand apart and different, keeping itself out of the firing squad, or now out of the line of fire, I would say, is a better way to word it, in terms of the the forces that are out there and polarized right now, at the same time as it continues to be the journal of choice for people who want to publish environmental health sciences research.
I always felt it was because we were published by the government, it was really inherent that we publish evidence-based objective information. And again, the care with which the associate editors and the science editors interact with the authors at the end to look and make sure that the conclusions are based on the evidence and that the authors don't overextend them, which is very easy for authors to do when they're very impassioned about a concern. I also think that maintaining that persona can be done through editorials, through hearing from the editor, through what's on the website about the relationship between the journal and the government. And I think as long as the outside world sees evidence that the journal's objective and solid and evidence-based, that will be fine going forward.
I don't know, I often look at it as environmental health being the umbrella and public health and other, occupational health as under that, because if it is not environment, what else is it? So anyway, I think by remaining,
and if you think broadly enough about what makes up your environment, it's all there, right?
Yes, it's absolutely all there, and which is a real tough task for a journal like EHP. Well, it's a tough journal for any type of journal that focuses on environmental health because it's so broad. You're not just going to look at one thing, whether a biochemical reaction works or doesn't work. It's a broad thing, but an exciting time.